I'm very pleased to introduce our first speaker today. Chris Hollis is Professor of Child and Adolescent Psychiatry at the University of Nottingham and consultant in neurodevelopmental neuropsychiatry with Nottingham NHS Foundation Trust. Chris trained at the Maudsley Hospital and Institute of Psychiatry, completing a PhD on long-term adult outcome of adolescent onset psychosis. His clinical and research interests include ADHD, Tourette's, early onset schizophrenia, and the use of digital technologies to support better mental health. As director of MindTech, Chris is involved with bringing together patients, clinicians, academics, and technology developers to build the evidence base for use of digital technology in mental health care. So I'm delighted to introduce Chris Hollis today to talk to us about youth mental health in the digital world. Thanks.
Thank you, Ashley, for that very generous introduction. It's fabulous to be with you this morning. I wish we were with each other actually in person, but these are COVID times, and it's still, I think, really important that we have this time to think and to meet together. It's a really exciting program. I see that there's quite a bit of thinking around youth mental health, and Andrew has just highlighted the COVID challenge, particularly for mental health in younger people. And I know the program is also focusing on digital, and Prof. Inez Gimenez will be talking about digital mental health later this afternoon. So I will start to say that I can't be with you, which is a great shame, but I am speaking from Nottingham, which is the home of Robin Hood, who is famous for his redistributive politics. And Nottingham has quite a tradition of rebellion and bucking the trend, and I think at this particular time this is really important. But I'm speaking to you also from Nottingham, from the MindTech, which is the NHR Mental Health MedTech cooperative. This is NHR infrastructure in England, and MindTech is the only MedTech cooperative focusing on mental health, which is developing and evaluating digital technologies for mental health across the lifespan. And this is our building that we occupy in normal times, the Institute of Mental Health in Nottingham, which is on the Innovation Campus, and we're particularly well placed to be co-located with computer science, with engineering and other relevant disciplines that allow us to work collaboratively in digital mental health. And this is part of our fantastic team, the MindTech team, and much of what I'll be talking about today will come from their work, but also other collaborators throughout the UK, but also internationally. So I'm going in about the next half an hour to discuss the youth mental health crisis, and this was a crisis pre-COVID, and we've heard and seen that young people are disproportionately affected in terms of mental health and in terms of the impacts on the economy and education. So this crisis is even greater crisis than it was pre-COVID. We're going to focus on digital media and the digital world, both in terms of thinking about possible links and how the digital environment may contribute to mental health difficulties, but also how it could be of assistance and in terms of benefits and interventions, and what the evidence is really around both of those, both in terms of risks and benefits, and some thoughts about where this is going forward for future research, practice and policy. So the youth mental health crisis, we know that adolescence, which we increasingly define now up to age 25 in terms of brain development and maturation, the 3/4 of all problems in mental health begin before the age of 18. And that particularly in later teens and adolescence, there is a burgeoning increase of unmet needs in terms of depression, particularly depression and anxiety, But perhaps even more critically, there is this treatment gap with about 70% of young people with mental health disorders receiving no help at all. And when we think about digital technology, we've tended to polarize our views in terms of it either being helpful or harmful. But the last 15 years or so have seen an absolute transformation, the digital revolution, both in terms of the access to technology, but also in terms of digital health. And I'm going to talk a little bit later about some of the opportunities to close the treatment gap, as well as some of the technologies that you'll hear about perhaps later today in terms of personalized therapy, potential monitoring and tracking technologies. But I'm going to focus most of the talk on the digital environment and its potential risks for young people, and really the evidence to support that, because many claims have been made, but often without strong substantiation. In August of this year, we colleagues with Sonia Livingston at the LSE and Edmund Sanuga-Bark at King's wrote an editorial for a special edition of the Journal of Child Psychology and Psychiatry, which was coined the digital technology, the triple-edged sword. And we really want to draw attention there to not just the sort of binary distinction between harms and benefits, but certainly thinking in terms of also the importance and the benefits of digital technology for young people. And this has perhaps come even more to the fore over the last 6 months or so with COVID, in terms of providing the medium for social connectivity and learning for young people, which has never been more important. But also there are the societal concerns about digital technology, societal, intellectual, mental health risks, and the potential for it to be integrated more into mental health practice as a way of a tool for early identification, and also remote treatments and delivery of digital therapeutics. So to turn first to the area of potential risks and mental health, and much of the publicity is often focused on what might seem to be a moral panic, a huge concern about potential risks for young people, particularly around self-harm, about the use of social media, but also potentially the impact of technology on social and intellectual development. And I think what we see with children and young people is that they are the greatest users of digital technology, and they have the most to gain, but also potentially most at risk. But what we also need to be aware of is the moral panic that surrounds this. This is an easy topic to pick up and to speak about, often without a good evidence base underpinning it. And we've seen this with other technologies historically over time that have been adopted, particularly with young people, and concerns about risk generally outweighing the benefits, and also not taking young people's views themselves into consideration. So I'm going to just bring that back to some sort of clinical focus, and this is a case that I was involved in myself when I was on call as a child and adolescent psychiatrist, and I think it brings home some of these issues. So Chloe was a 17-year-old. She had depression and anxiety, but wasn't attending clinic appointments, and spent on average over 5 hours a day online. And she's been looking for support online, but wasn't able to find trustworthy help or differentiate a lot of the information that she saw and online, and really understand what was likely to be helpful or not. And social media bullying for Chloe was a really important trigger to her crisis, and also presentation of self-harm. So for Chloe, like many young people that I see, but in our studies, the digital world is both part of the problem, but also potentially part of the solution. So I'm going to focus on some of the data, and this is data collected in England from large epidemiological studies, the morbidity studies of mental health morbidity studies of children and young people. The first of these was conducted in the late 90s. A second sweep was repeated in the early 2000s, but there was a large gap and really no good data until the 2017 sweep. The main sort of headline findings is that the overall prevalence of disorder in 5 to 19-year-olds was 1 in 8, and that had gone up from 1 in 10 in 2004, and about 5% actually had 2 or more disorders. So overall, we've seen since the early noughties about a 25% increase in disorder. This is in the population, not help seeking. So this doesn't necessarily represent the even greater increase that has been seen in use of services and demand. But in terms of the population prevalence, about an increase of about a quarter. And the largest area of increase has been in the older teens, and particularly in girls, so that about 25% of girls in that 17 to 19-year-old age group meet criteria for a mental health disorder, predominantly depression and anxiety. And we see that about 50% of those young women actually have reported self-harm or made a suicide attempt. And this really follows from a rising tide of self-harm, particularly affecting the older adolescent age group and young women. And that's been a threefold increase since 2000, from 2000 to 2014. And this clearly is putting a major pressure on services, crisis services, and is, as you can see, is also quite strongly related to underlying mental health disorder. So that's the background picture of mental health in youth, and that's a pre-COVID picture. And as we've heard earlier, we're gathering data. There's a new sweep of that population, which is currently ongoing in the COVID crisis to examine impacts. But I want to look at the potential contribution of digital media to this process. And what we've really seen is probably that the ubiquity of digital media is perhaps the biggest change in the socialization of young people since the Industrial Revolution. In terms of the age groups that we're dealing with, there are the different generations who've been in contact with digital media. But the group I'm going to focus on today are the so-called millennials, post-millennial digital natives born around about the turn about 2000. And they're a group that have been studied in some detail, and are different in the sense that they've grown up surrounded by ubiquitous digital technology, which is not something they've had to adapt or incorporate, but it's been really part of their lives. Some of you may be familiar with some of this technology that some of us, the older members of the generations, have grown up with and had to adapt to. So these are data from the Ofcom surveys, just to get a sense of how pervasive digital media use is in children and young people. And in the 8 to 11-year-old group, just under 20% had a social media profile in their 2018 survey. And over 2/3 of 12 to 15-year-olds had a similar profile, despite the fact that the major social media platforms actually put a limit at age 13. So there are many young people actually who are using aspects of digital media below those recommended thresholds. And in terms of how young people actually rate their experiences, in terms of positive experiences, they see social connection and well-being being particularly important. And we've seen this through the lockdown and through the COVID crisis. And the challenges that young people report are social comparisons, fears of missing out, and harassment and online bullying. A key issue for young people in digital media is sleep and the impact that screen use has, particularly late at night, as well as increasing distraction, anxiety related to use late in the evening. And we can see that surveys show that probably certainly over 2/3 of young people are taking these tools to bed with them, and this is going to have clear impacts on sleep, with follow-on effects the next day on mood and cognition. In terms of how parents have viewed this, they tend to be more pessimistic over the last decade, really, in terms of the impacts of digital media. And it'll be interesting to see some of the emerging data on the potential impacts over the COVID crisis, where I think there has been a sort of change of perception, with some also greater focus on some of the benefits in terms of keeping young people in education and keeping them connected with their peers. So moving on to the links and the research underpinning that, I'm going to focus particularly on work by our colleagues Yvonne Kelly and also Pravita Pavale at UCL on the Millennium Cohort Study, which was probably one of the more informative studies in terms of both being able to examine mental health that was carefully measured, and also digital media use. But first of all, I wanted just to follow up on the national survey, the data I showed a few minutes ago in terms of the mental health of young people in England in 2017. And they were asked questions about digital social media time and screen time. And in terms of this being a cross-sectional survey, for those that had a disorder, so we heard that was about 12%, they were twice as likely to spend more than 4 hours using social media than those without a disorder. And in terms of the problems that the young people with a disorder, where they were more likely to say they compared themselves to others, that they were concerned about comments and shares that had an impact on their mood, that they felt they were spending more time online than they should do, and also a sense that they couldn't be honest and direct about their feelings. And I think this is particularly important in understanding what the particular risks and concerns of digital media use are for young people with mental health problems, and that their usage may be different, and that the impact of the technology will also potentially be different for young people with pre-existing mental health difficulties. We also looked, this study also looked at cyberbullying, which was increased in those that had a disorder, both in boys and girls, but also they were more likely to be perpetrators of cyberbullying if young people had a mental health disorder. So I just want to go on to focus on potentially how this could impact on young people's mental health. And here I'm going to draw on the Millennium Cohort study data. The Millennium Cohort extends beyond the study of England to all 4 countries of the UK. And that was a birth cohort drawn 2000 to 2002. And this cohort had been studied in 6 sweeps, and there's recently been a 17-year-old sweep, and that data is currently being analysed as we speak. And the population was just over 10,000, and there was good data on recorded social media use, but also mood, bullying, self-esteem, sleep, body image. So the data I'm going to report here is the 14-year-old sweep. As I said, we're awaiting the analysis of the 17-year-old sweep, which will allow longitudinal risk to be fully assessed. But in the 14-year-old sweep, we can see that there's a trend there with certainly girls having particularly disproportionately large amounts of social media exposure, And at the threshold of over 3 hours, that was about 2/5 of girls and 1/5 of boys. In terms of depressive symptoms, the baseline in girls was around 11%, and that increased in a fairly linear fashion with exposure up to just under 40%, with clinically relevant depressive symptoms with more than 5 hours exposure in girls, and really a less marked and a rather less clear effect in boys. In terms of the other specific activities, those with the longest online exposures were more likely to be involved in online harassment. They had poorer sleep, lower self-esteem, and also reported more unhappiness with the parents. And this again affects particularly in girls. And the main caveat of this research at this point was it's cross-sectional, but modelling was still able to be conducted, showing some direct effects of social media use on depressive symptoms, but also moderation through poor sleep, harassment, poor self-esteem, and poor body image. In terms of social economic risks, it was seen that the lower income households generally spend longer, so children from those environments on screens than those from higher income backgrounds. And there's also evidence from European studies that that more affluent parents are more likely to actively mediate screen time. So to conclude those links, social media is certainly in screen time associated with depression, particularly in adolescent girls, but this is a cross-sectional relationship, and the effects of causality remain uncertain and really awaiting the longitudinal data which the Millennium Cohort is currently undertaking the analysis. The negative effects appear to be mediated through poor sleep, harassment, poor body image, and low self-esteem. And young people at risk in the offline world, through a range of risk factors, appear to be more at risk online. And this is something we described as amplifying effects of the digital world. Digital platforms and social media also provide important benefits, ones that we've been able to see particularly during the COVID pandemic, in terms of information, social connection between young people, and also access to therapeutic support. Crucially, the content and context of online exposure is going to be more important than screen time alone. And often the measures to date haven't looked at this in significant fine-grained detail. And most young people exposed to distressing content or harassment are currently not receiving support. So I'm going to finish off in the last few minutes of this talk to say a little bit more about the potential health and mental health benefits of digital interventions, where we are at the moment and where we're hoping to move. So I think in an area where there haven't, certainly in mental health, where there haven't been major therapeutic advances in terms of interventions, digital health interventions offer potential new non-pharmacological treatments. They offer potentially greater objectivity in diagnosis, monitoring and measurement in mental health, and perhaps most crucially as well, improve the scale and the access to treatment, and provide a way that is convenient and that breaks down some of the access barriers into traditional mental health services. One of the challenges, though, and this is Gartner's curve of hype, is that we have to balance the promise against the evidence of digital interventions. There are many thousands of mental health apps which are not evaluated, that quickly are made available. but it's very uncertain, and particularly for the public really to differentiate which are helpful and which really have no benefit at all. And so there is a real challenge in terms of carefully evaluating these interventions that tend to the technology changes rapidly. The pace of technology development is fast, much faster than the typical pace of clinical trials and traditional research evaluations. And there's a real tension there. And I think it's also an area where methodologies and opportunities are moving faster with trials and evaluations, but also doing more real-world studies in practice are needed. And we need the platforms to do that, which currently don't exist. So claims are being made about a lot of digital technologies and interventions. This is one which has actually received FDA approval. It's a video game for children training cognitive training program for children with ADHD, which has had FDA approval in the States. And there's a lot of marketing, and there's a lot of effort that goes often behind the promise of these. In fact, the evidence base for these interventions is often quite slim and quite limited. And this is a particular example of an intervention which has some benefits for some aspects of cognition, but to date hasn't been shown clearly to have translation of carryover effects to other aspects of ADHD symptoms, or potentially longer effects over time. But also, this intervention isn't currently available in the UK. But this type of publicity does raise expectations about its potential. So we've conducted a large systematic review and review of research in this area. And again, young people have benefited much less from digital technology interventions. And this is, again, something of a paradox in the sense that both there's a huge unmet need and there's a potential interest in use of these interventions, but far more research and far more work has been conducted in adults. But those interventions don't necessarily generalize to young people, and young people need interventions which are tailored to their own needs. So one area that is, I think, important to highlight is the area of digital CBT for depression in young people. So the NICE guideline for depression in young people focused on the potential for digital technologies, particularly for mild depression in children and young people. And one technology that they recommended and mentioned in terms of the evidence base was Sparks, which is a gamified CBT intervention developed and trialed in New Zealand, also in Australia by Sally Mary and colleagues. Sparks is shown to be both clinically and cost effective, and compares favorably against gold standard face-to-face CBT treatments, and is highly acceptable and positively reviewed by young people. But currently Sparks isn't available in the UK. The platform isn't developed to run Sparks, and neither is StressBusters, the other intervention. So we have an issue that actually we don't have the access to the type of interventions which could be helpful to young people currently in the UK. And it was really for this reason that we've been collaborating with New Zealand and also colleagues in Australia to adapt and create a platform for making interventions such as Sparks and other digital CBT interventions, both self-guided and guided, available for young people in the UK. But this is really a major gap. And also it's a gap in terms of how we can evaluate and continue to iterate and develop these interventions at scale. So I just want to highlight this problem, not just in this area, but moving from research into routine care, particularly in digital health, is a huge challenge. We need joined up thinking between research funders and those providers of NHS care. And I think more fundamentally, the development of digital platforms and NHS digital platforms, which I think would potentially avoid problem we're finding at the moment, which is increased outsourcing of digital therapeutic interventions to providers that don't have such a research base. And rather than blending those interventions into the NHS, building on the workforce expertise so that digital becomes another tool in the toolkit for clinicians, it's often seen as a sort of somewhat siloed and separate service. So I'd like to just conclude by saying that the digital world is clearly here to stay. It's actually what's supporting this conference and this talk. I wouldn't be here if we didn't have those forms of communication. At its most sort of immediate effect, telemedicine has come to the fore also over the last six months, and has changed very much the way we practice and the way that perhaps people working in the mental health field actually think in terms of their day-to-day experience about digital health and its potential. But I think we need to harness the benefits and also be thoughtful and mitigate the risk, but in an evidence-based way. We clearly need better longitudinal research before jumping to conclusions about risk, but particularly we need to understand about those who are most at risk and what protective factors need to be strengthened. Digital interventions have real promise in closing the mental health treatment gap. In fact, there's no other way of doing it. It's not possible in terms of without using digital. But at the moment, we have a real paucity of evidence-based interventions and really a lack of the platform and infrastructure to run these interventions and integrate them and blend them into standard care. And this is really a fundamental policy and strategy issue. And at the moment, there is no really clear digital mental health strategy in the UK, and as far as I'm aware, in the developed nations. But we are working with colleagues internationally to adapt and bring evidence-based interventions to the UK, as well as undertaking our own trials of interventions for young people. And as I said, working towards the design of the type of platform which is needed to implement and evaluate these interventions, which are going to be increasingly important in the post-COVID world for clinicians and for young people. So I'd like to finish at that point, just to let you know that our MindTech Symposium this year, which is focusing on digital mental health in the age of COVID-19, bookings are open. It's going to be covered over the 2nd and the 3rd of December. So please, it would be wonderful if you were able to join us for any part of that event. When we'll have the opportunity, we'll have speakers and panelists from around the world, really to drill down into these issues of how digital mental health and response can help to really alleviate the mental health crisis and the challenges posed by COVID-19. Thank you very much.
Thank you, Chris Hollis. That was a great talk. There was so much covered there, and of course, as you say, such a topical issue at the moment because of the effects of lockdown. We do have time for questions now, so if I can ask the audience to type questions into the chat box, which you should see to your right, and we'll go through a few of those questions just now. I have a disclosure. I'm an old age psychiatry consultant in my day job, so a lot of this is quite new to me. But one thing I thought was really interesting is about that double-edged sword between stigma and normalization. So, you know, here with digital technologies, we've got the opportunity to tackle stigma through getting information out to more individuals and to educate those who don't have mental health issues. Versus the other side of the coin of normalization. And a lot of the time people get concerned about that in the context of self-harm or suicidality. Do you have any thoughts on whether normalization or perhaps copycat behavior is a real risk?
I think the issue with that we've seen with self-harm really is it's more potentially how for some young people, it really does mirror or amplify their offline experiences, that they can be, in a sense, more exposed, particularly, and find it difficult to sort of switch off those sort of negative main issue that we've been concerned about. I think in terms of the sort of contagion issue, I think that's potentially less of an issue, although we are obviously concerned about dangerous content. I mean, clearly there is dangerous content in terms of areas like eating disorders and pro-ana sites, etc. I think most young people are increasingly sophisticated about how they negotiate and navigate the online world, but I think we need more. This is where education is particularly important, and recognizing how potentially to see the quality of information and the sort of whether the information that they get should be sort of scrutinized more carefully. But I think the other area that's important is that it breaks down some of the stigma of seeking help. So we do know that in terms of sort of lowering the threshold for help seeking, this is really important, and this is where digital, I think, can really come to the fore.
Yeah, and it means that those who have a more unusual mental health disorder could potentially access peers or tailored support that they wouldn't have access to within their own local network.
Absolutely, yeah. And I think we see this. I mean, one of our areas of work in neurodevelopmental disorders, we have a clinic for young people with tic disorders, which is really poorly provided in terms of a lot of local provision around the country, very uneven, and having both digital resources and a telemedicine service allows us to work with local clinicians, but also for young people not to have the postcode lottery, so they can access support remotely. And I think that's a different way of working than we've tended to have in the past. And I think that it just needs to be, we need to have the mechanisms that support and fund that type of approach, and also provide essentially young people with the kind of resources that they can also do more self-management as well. I think for but the difficulty they have at the moment is really understanding what can be trusted, and this is where, say, the NHS is really important in terms of being because young people do trust the information that they get from the NHS.
Yeah, I think what you said there is hugely important for areas with a big geographical area like Scotland, because it would mean that specialist support would be available even in rural areas. So potentially really important for us up here. Okay, better move on to some questions from the audience. We've got a question here from Alison Howard. I'll just read it out in case anyone can't see the chat. Although moral panics have surrounded technological advancement previously, that is, when TV first became widely used or when the internet became more widely used, would you say that smartphones specifically have the additional issue of their role in how we communicate, particularly as more features or apps are added to them?
Yes, that's a really good question, and it is how the technology is both sort of similar in a sense as a new technology, and it tends to be that older generations like my own, tend not to understand it and just see negative impacts and think it's sort of turning young generation to rack and ruin. In fact, they're huge benefits. I mean, particularly young people who feel quite isolated or socially isolated, or not having a peer group that they can connect with online has been very important. But I think it's the sense that it's both not it's bidirectional communication, and it really is almost sort of continuously on, so it's very difficult to switch it off. I guess the issue that we often concerned about is the underlying design of a lot of the technology, particularly where it's the underlying model is to increase usage, because where the funding model is often supported by advertising and the amount of time, the amount of clicks that young people use, there is a tendency to have the design done in a way which isn't particularly responsible for young people, particularly those who have mental health difficulties, and that's the issue. So sometimes it's understanding that young people with pre-existing problems are particularly sensitive to these issues and some of the overuse issues, which are really built into the design of the technology. And I think what we need to think about is how that technology could be designed more responsibly and offer potentially sometimes low-level support for young people who are experiencing distress while they're using it.
Yeah. Okay. Thanks. And we've got about 2 minutes left just for another question. This is from Donald McIntyre. Is a separate digital mental health strategy likely to be helpful, or does technology-enabled care need to be integrated into an overall strategy?
Well, that's a great question, and I'd probably say yes to both, because the second part is yes, we absolutely need to blend it in. I think digital is going to be, it's another tool, and I think what I'm concerned about is sometimes I see digital providers that is the only tool they have in their toolbox, when what we need to do is essentially see digital as a normal part of care, but blended with other forms of care. On the other hand, the strategy for digital, we've tended to think about digital strategies in terms of healthcare records and informatics. We haven't thought about it in terms of digital services. And also this strategy that we probably hear about later today of personal data, and how that can be used intelligently and thoughtfully to support mental care decision making. But the strategy of the platforms for delivering these interventions, I really do think that is lacking at the moment. And it's just not possible for an individual healthcare organization or service really to do this on their own. And I think this is something potentially in Scotland, which I think you probably have more opportunities to do well than in England, because of thinking about the sort of whole system, rather than sort of individual silos of delivery.
Okay, great. Thank you again, Prof. Hollis, for your talk today.